The main element that regulates the circulation of blood in the body is peripheral resistance, and this is inversely proportional to the sum of the dilatation of the organism arteriolar sphincters.
Factors of arteriolar tone: autonomic control, circulating hormones, endothelium-derived factors, the local concentration of metabolites. The vasomotor center is a collection of cell bodies in the medulla oblongata of the brain that regulates or modulates blood pressure and cardiac function, primarily via the autonomic nervous system. Organic factors such as hormones are often potent vasoconstrictor. In other words, increase peripheral resistance and decrease the blood flow in the tissues. By contrast, local factors such as the substances produced by the endothelium are powerful vasodilators. Metabolites are organic compounds used in or created by the chemical reactions that happen in every cell of living organisms. This response is probably the most important mechanism of autoregulation of blood flow. The principle that the volume of a homogeneous fluid passing per unit time through a capillary tube is directly proportional to the pressure difference between its ends and to the fourth power of its internal radius, and inversely proportional to its length and to the viscosity of the fluid. The letter Q represents the blood flow, or its speed. The letter P represents the pressure difference between the end and the beginning of the blood vessel. The letter R is the radius of the blood vessel. The letter N represents the viscosity of blood, and letter L the length of the blood. Velocity of a laminar flow is directly proportional to the pressure gradient and the square of the ratio, and inversely proportional to the length of the tube and the viscosity of the fluid. Volume flow is proportional to the fourth power of the ratio, so even small changes in radius can result in big changes in flow. Changes in the diameter of blood vessels are the most important pathology for vascular ultrasound. Changes in blood pressure are more related to cardiac pathologies. 10% decrease in radius produce 35% decrease in blood flow. 50% decrease in radius produce 95% decrease in blood flow. Laminar flow is directly proportional to the pressure gradient and the fourth potency of the ratio up the blood vessel, and inversely proportional to the length of the tube and the viscosity of the fluid. In this formula, the P of pressure is changed by the pressure difference on each side of the blood vessel. Now, let's move the pressure difference or gradient to the other side of the formula. Now in the formula, the blood flow is divided between the pressure difference is equal to the number pi times the radius of the blood vessel to the fourth power divided by the viscosity of blood multiplied by the length of the blood vessel, and the number 8, inverting both sides of the equation, become the pressure gradient divided by the blood flow is equal to 8 times the viscosity of the blood multiplied by the length of the vessel divided by the number pi times the radius of the blood vessel to the fourth power. Ohm's law states that the current through a conductor between 2 points is directly proportional to the potential difference across the 2 points. Introducing the constant of proportionality. The resistance, the same formula can be expressed in this way. Voltage is analogous to the differential pressure, and blood flow is analogous to the intensity of the electricity, and the formula applied to electricity is also suitable for the blood. 8 times the viscosity of the blood, which is almost always constant, multiplied by the length of the vessel, which does not take into account because the complexity of the blood connections divided by the number pi and the radius to the fourth power is equal to the resistance of the blood. Blood flow resistance mainly depends on the radius of blood vessel because this raised to the fourth power, whereas the viscosity of blood is almost always a constant value. Bernoulli's principle states that for an inviscid flow, an increase in the speed of the fluid occurs simultaneously with a decrease in pressure or a decrease in the fluid's potential energy. This requires that the sum of kinetic energy and potential energy remain constant. Potential energy is the pressure in any part of the tube, and the kinetic energy is the velocity of blood. flow in the arteries is normally laminar, but turbulent blood flow may occur in arterial bifurcations and in areas close to joints, and is not a disease. Laminar flow is orderly flow, where energy expenditure has been reduced to a minimum, multiple layers of blood moving at similar speeds concentrically, where the outer layers are slower and the center of the flow is more rapid. Laminar flow has a narrow range of velocities. Velocities are not very different in the layers, faster in the center, but not too much. By contrast, in turbulent flow, the liquid is moving in different directions and speeds in a disorderly manner. In turbulent flow, the energy is lost rapidly, and the artery resistance also is increased. Reynolds number is used to check whether the flow is laminar or turbulent. It is denoted by Re. This number got by comparing inertial force with viscous force. Reynolds number is equal to velocity of the blood. Q is density. The radius of the artery. Divided by the viscosity of the blood. Laminar flow tends to be disturbed if the Reynolds number exceeds 2000. The Doppler effect is the change that happens to the frequency of a wave due to different speeds between the object that produces the wave and the object that receives the wave. The echo frequency minus the frequency of the transducer is the Doppler shift. The Doppler shift is directly proportional to the velocity of red blood cell. When the red blood cell approaches the difference between the transducer frequency and the frequency of echo transducer is positive. Received frequency exceeds transmitted frequency. When red blood cells away from the transducer, opposite occurs. Received frequency is less than the transmitted frequency. The Doppler shift uses the same units as the sound because it is the subtraction of the echo frequency and the frequency of the transducer. The Doppler shift is not a sound as a math operation between the frequencies of two sounds as an abstraction. When ultrasound collides with a red blood cell that is moving perpendicularly to the direction of ultrasound, no Doppler shift occurs. Although the Doppler shift is not an actual sound, as its frequency is in the audible range, can produce sound through the speakers of the ultrasound machine. The Doppler shift varies in relation to the angle between directions of the ultrasound pulse and red blood cells. The actual speed of the red blood cells is obtained by compensating the Doppler shift by the cosine of this angle. The Doppler equation is the mathematical relationship between the frequency shift and the velocity of red blood cells that produce it. The Doppler equation states that the Doppler shift is equal to 2 times the frequency of transducer multiplied by the speed of the red cell and the cosine of the angle between the directions of the ultrasound and the red blood cell, and dividing by the speed of sound in soft T. The blood velocity is equal to the Doppler shift multiplied by the speed of ultrasound, all divided by 2 times the transducer frequency multiplied by the cosine of the angle between the directions of the ultrasound and blood. Doppler tips. Use a little gate. Put the gate at center of the vessel. Rotate the angle parallel to vessel walls. Duplex ultrasound is the combination of spectral Doppler and B-mode ultrasound. In this image of a vascular ultrasound study, at the top there is a beam mode image with the cursor to place it in the area of the artery, and below the spectral Doppler, which is a function from time and blood velocity. Spectral Doppler may be obtained in two ways: with pulsed ultrasound, using the same transducers used for beam mode, and with continuous transducers. The continuous ultrasound cannot produce images, it can only produce spectral Doppler. The advantage is that it does not have any speed limit that cannot be registered. Continuous ultrasound never produces aliasing. Continuous waves. Major disadvantage: Doppler shifts arise all along the length of the beam. The spectrum produced by a continuous wave system displays Doppler shifts created by any blood cells intersecting the path of the sound beam. This is called range ambiguity. Ambiguity range can be defined as the inability of continuous ultrasound to correctly identify the distances from which come the echoes. That is the same reason why continuous ultrasound cannot produce images. The disadvantage of the pulsed ultrasound spectral Doppler is that when blood velocities are too high, cannot be registered. This is called aliasing. Aliasing is the most commonly observed artifact in pulsed Doppler imaging. The Nyquist limit is obtained by dividing the pulse repetition frequency by 2. The Nyquist limit may be changed by the operator when decreases the depth of the image. The most important feature to be taken into account for the diagnosis of arterial obstruction is increased blood velocity in the stenotic area. The presence of turbulent flow after the stenotic area is important too. Changes in the shape of the pulse in the affected arteries also can be seen. Also, a decrease in arteriolar resistance after the obstruction. Color flow imaging. Much of the information obtained with spectral Doppler can also be observed with Doppler color, but color Doppler information is qualitative and the spectral Doppler is quantitative. Color Doppler can help locate the stenotic areas to measure them with spectral Doppler. It is not quantitative, so it alone cannot be used to grade arterial stenosis. Only pulsed ultrasound can produce images. Color Doppler is color over a beam mode. Remember, continuous Doppler only can record spectral Doppler, but not color Doppler. Power Doppler is a modality of color Doppler with no aliasing. In arteries, each cycle of cardiac activity produces a distinct wave on the Doppler frequency spectrum. The term waveform refers to the shape of each of these waves. Peak systolic is the part of the wave with the maximum velocity. And diastolic is the part of the wave with the minimum velocity. The window is characteristic of a normal laminar flow. Envelope is the outer part of the wave. Dicrotic notch occurs when systole finish and diastole begins. Analyzing the waveform of the spectral Doppler, pulsatility of an artery can be low, moderate, or high. The two more important characteristics in the shape of the wave of the external carotid artery is a sharp upstroke and little diastolic flow. External carotid artery is an artery of high pulsatility and high resistance. High pulsatility because the sharp peak, and high resistance because the low diastolic blood flow. This is a true picture of the spectral Doppler vascular study. Note that the window is black and the envelope is white. low pulsatil Doppler waveforms, as the internal carotid artery has round systolic peaks and diastolic velocity greater than high-resistance arteries. In the internal carotid artery, the dicrotic notch is usually not especially discernible. Pulsatility of an artery decreases when the resistance to the passage of blood also decrease. In general, the internal organs oppose little resistance to blood flow. Low-resistance arteries never have reverse blood flow, as some high-resistance arteries have. A good example of a low-resistance artery is the internal carotid artery. This artery mainly feeds the brain, an organ that uses a large amount of blood. It is important to note the round shape of the peak systolic and the high speed of blood flow during cardiac diastole. This is the real ultrasound spectral Doppler of the internal carotid artery. The common carotid artery has elements of both branches because it bifurcates in the internal and external carotid arteries. Common carotid arteries have an appearance between the low and high resistance waveforms. Common carotid arteries have a sharp peak but also a high diastolic flow. This image shows how it looks really, the spectral Doppler of common carotid artery. Normal flow in the leg arteries is multiphasic because are high resistance arteries. This wave could correspond perfectly with the femoral artery waveform. Note the reverse flow, which is a characteristic of high resistance arteries. After a stenosis, waveforms will appear damped. Peaks are round and diastolic velocity high. Peripheral resistance decreases after a stenosis due to the low amount of blood flowing. Pulsatility index is an arterial blood flow velocity waveform index designed to quantify the pulsatility. Pulsatility index is equal to the difference between the maximum and minimum speed divided by the average speed of a one cardiac cycle. Resistive index is a simple parameter that can be derived from an ultrasound Doppler spectrum. The systolic-diastolic ratio is equal to the maximum speed divided by the minimum speed. The change of velocity of the blood or acceleration is other important physiological information, very helpful for vascular diseases diagnostic. The time between the end diastolic to the peak systolic normally is very short in arteries. Distal to a stenosis, blood acceleration is not more very fast, and the shape of the wave change become more flat. Both acceleration time and acceleration index expressed quantitatively changes in blood velocity. When there is narrowing of the arteries, called stenosis, both the time it takes the wave from the end of diastole to maximum speed, called acceleration time, and acceleration during systole. The ankle brachial index, ABI, is a simple, reliable means for diagnosing peripheral artery disease. The ankle brachial index, ABI, is the ratio of the blood pressure in the lower legs to the blood pressure in the arms. Compared to the arm, lower blood pressure in the leg is an indication of blocked arteries. The ABI test is simple enough to be performed in any doctor's office. Between 0.9 and 1.2 considered normal, free from significant PAD, while a lesser than 0.9 indicates arterial disease. An ABPI value greater than 1.3 is also considered abnormal and suggests calcification of the walls of the arteries and incompressible vessels. However, ABI has known issues. ABI is known to be unreliable on patients with arterial calcification. This is often found in patients with diabetes, renal failure, or heavy smokers. Although the ABI is extremely reliable, this test may not be accurate in all patients. Some patients with long-standing diabetes, kidney disease, or some elderly patients may have rigid blood vessels. Segmental pressure measurements uses same devices as ABI, but in a more complex form. It is very similar to the ankle brachial index. As you see, is more time-consuming and need a computer to operate the multiple pressure cuff. Continuous Doppler is better than pulsed. Changes in volume are equal to changes in arterial pressure. Some easy skills are necessary. Ease of operation. Reproducible. Fewer artifacts than Doppler technology. Normal plethysmographic waveform characteristics, brisk systolic upstroke. Sharp systolic peak. Gradual downstroke component. Dicrotic notch. When we compared the arterial waveform obtained with plethysmography or Doppler, we see some similarities, but the plethysmographic waveform are never negative. They represents pressure, and arteries have never negative pressures. The absence of the dicrotic notch is the first sign of arterial occlusive disease or PAD. Paradoxically, distal to the stenosis wave velocity in systole increases due to decreased peripheral resistance. In this image, it can be seen that the wave is like the wave of a low-resistance artery. Abnormal plethysmographic waveforms that accompany increased disease severity include prolonged upstroke, rounding of the systolic peak, waveform downstroke away from the baseline, when the stenosis is severe, wave is completely flattened. Gradually, the wave will flatten with the development of arterial occlusive disease. Other factors that affect waveform amplitude are patient positioning, edema, obesity, blood pressure, blood volume, vasomotor tone, and ventricular stroke volume. Photoplethysmography, PPG, is a simple and low-cost optical technique that can be used to detect blood volume changes in the